Okay, guys, this discussion E for you tonight. We're discussing upcoming Medicare Medicaid rules for 2026. Okay, that's E tonight for you. So let's get going on presentation I made for you. Upcoming Medicare Medicaid rules for 2026 embedded in legislation called the One Big Beautiful Bill are described as potentially transformative but also destabilizing. They represent one of the largest restructurings of the U.S. public health insurance in decades, with consequences that could ripple across affordability, access, and the stability of care for more than 138 million people currently covered. What the rules change. Medicaid restructuring. The bill slashes an estimated $1 trillion in federal funding, primarily by reducing the federal match rate for the 40 states that expanded Medicaid under the Affordable Care Act. States will be forced to absorb a larger share of program costs, which could push them to cut benefits, restrict eligibility, or raise taxes to compensate. New eligibility requirements. Adults aged 19 to 65 must complete 80 hours per month of verified work or community engagements, employment, volunteering, or education to maintain coverage. Except exemptions exist for pregnant individuals, people with disabilities, and caregivers of young children, but the majority of working aged adults will face this new hurdle. This requirement introduces a significant administrative layer, as states must track, verify, and enforce compliance. Who is most affected? Low income adults earning under roughly $21,000 per year. Those who gained coverage through ACA expansion are at the highest risk. Caregivers and vulnerable populations may experience indirect strain as family members lose coverage or face interruptions. The Congressional Budget Office, or CBO, projects 1.3 million people will become uninsured in 2026 alone, while some experts warn The total could reach 10 million over time. Likely consequences for access and affordability. Coverage losses. Millions could lose insurance either because states cannot afford the expanded roles or because individuals fail to meet the new work community engagement requirements. Administrative burden. Verification systems will likely be complex, leading to delays, errors, or gaps in coverage. Even those who qualify may lose insurance temporarily due to paperwork lapses. Healthcare system strain. Providers, especially SafeNet, hospitals, and clinics could face higher compensated care costs as uninsured rates rise. Caregiver stress. Families caring for elderly or disabled relatives may face greater financial and emotional pressure if coverage is lost. Timeline and what to watch. 2026 implementation. The rules take effect in 2026, but the next year will be critical as states decide how to absorb funding cuts and design compliance systems. State verification. Outcomes will offer or differ sharply by state. Whether states may find ways to cushion the impact, while poorer states could see dramatic coverage losses. Legal challenges. Work requirements have historically faced lawsuits with courts questioning whether they align with Medicaid's mission of providing health care to low-income populations. Political debate. Expect intense debate among lawmakers, advocacy groups, and healthcare professionals about whether these changes promote responsibility or simply erect barriers to care. Bottom line, the 2026 Medicare Medicaid rules are not minor adjustments. They represent a fundamental shift in how the U.S. approaches public health insurance by cutting federal supports and imposing new eligibility hurdles. The legislation risks leaving millions uninsured, straining state budgets, and reshaping safety net that has defined American healthcare for decades. Would you like me to break this down into community impact framework? For example, how rural areas, caregivers, and marginalized groups might each experience these disruptions differently. That could make the implications more tangible for your work on equity and aging. Okay, guys, I'm going to leave the floor open for discussion. I put the topic up there for tonight's discussion. I hope to get some feedback from y'all to see if we can do another show on this or not. I'm going to sit here and leave it open for a couple minutes to see if anybody wants to answer a question.